During his Senate confirmation hearing for Health and Human Services Secretary Robert F. Kennedy Jr. raised concerns about the effectiveness of the $900 billion Medicaid program, questioning whether it truly improves Americans' health. He challenged lawmakers to reconsider current healthcare policies, advocating for reforms that emphasize transparency, accountability, and a shift towards value-based care.
Well, President Trump has given me the charge of improving quality of care and lowering the price of care for all Americans. There are many things that we can do. I mean, what we want to, the ultimate outcome, I think, is to increase transparency, to increase accountability, and to transition to a value-based system rather than a fee-based system.
So
rather than a service-based
on Medicaid in particular, can you just kind of take those kind of general principles and apply it to the Medicaid program?
I listen. I think that there are many options with telemedicine, with AI right now, and there's including direct primary care systems. We're seeing that movement grow across the country. There's one of the largest.
So going back to Medicaid though, and speaking of these specific advances, what reforms are you proposing with these ideas vis-a-vis Medicaid?
Well, I don't have a broad proposal for dismantling the program.
Of course not saying that.
I think what we need to do is we need to experiment with pilot programs in each state. We need to keep our eye on the ultimate goal, which is value-based care, which is transparency, accountability, access.
And one more thing, going back to Medicare, you mentioned you're an MA. You mentioned earlier the Medicare fee-for-service. Do you have any kind of thoughts as to whether or not patients on fee-for-service should move into MA, or how should we handle that?
Whether patients
who are on Medicare
and traditional Medicare,
yes,
that's their choice right now. Well, I mean, we have, I think, 32 million Americans, or 30 million Americans on Medicare, on traditional Medicare, and then another 34 or 34 on Medicare Advantage, roughly half and half. And I think more people would rather be on Medicare Advantage because it offers very good services, but people can't afford it. It's much more expensive. Oh, in answer to your first question, there are all kinds of exciting things that we can be doing, including cooperatives, which President Trump has supported, including health savings accounts, which President Trump has supported. But all of these things to make people more accountable for their own health.
And so we'd bring the cooperatives and the health savings accounts into Medicare and Medicaid?
Exactly. We try to increase those, the use of those, and to direct primary care to continue to transition into a value-based program that is private. Americans don't, by and large, do not like the Affordable Care Act. People are on it. They don't like Medicaid. They like Medicare. And they like private insurance. We need to listen to what they would prefer to be on private insurance. Most Americans, if they can afford to be, will be on private insurance. We need to figure out ways to improve care, particularly for elderly, for veterans, for the poor in this country. And Medicaid, the current model is not doing that. I would ask, any of the Democrats who are chuckling just now, do you think all that money, the $900 billion that we're sending to Medicaid every year, has made Americans healthy? Do we think it's working for anybody? Are the premiums low enough?
Kennedy, nominated by President Donald Trump, argued that the existing fee-for-service model encourages excessive spending without necessarily improving patient outcomes. Do you think the $900 billion that we're sending to Medicaid every year is making Americans healthy? Is it working? He asked, pressing for a critical evaluation of the system. He stressed the need for innovative pilot programs in states to experiment with new healthcare delivery models. Kennedy's vision includes expanding private insurance options and integrating alternatives like health savings accounts, telemedicine, artificial intelligence, and direct primary care. He pointed to Medicare Advantage as an example of a system that offers better services but remains out of reach for many due to high costs. Most Americans, if they can afford it, choose private insurance, he stated, implying that reform should align with consumer preferences rather than rely on government-run systems. Kennedy also highlighted the need to transition Medicaid and Medicare towards value-based care, where payments are tied to patient outcomes rather than the number of services rendered. He emphasized the importance of empowering patients with cost transparency and choice, arguing that such measures would lead to better healthcare decisions. Throughout the hearing, Kennedy's remarks sparked debate, particularly with Democratic lawmakers who defended Medicaid's role in providing health care to low-income Americans. He responded by challenging them directly. Are premiums low enough? Are health outcomes improving? Or are we just throwing money at a broken system? He insisted that simply increasing funding without meaningful structural changes would not solve the healthcare crisis. Kennedy proposed exploring alternative healthcare financing models, including cooperatives and increased reliance on direct patient care systems. He argued that greater personal responsibility and market-driven solutions would lead to better health outcomes and reduce costs. People need to be accountable for their own health, he said, reinforcing his stance that government intervention should be minimized where possible. Kennedy's confirmation hearing underscored a broader ideological divide over the future of American healthcare. His approach aligns with conservative principles advocating for reduced government involvement and increased competition. Supporters view his proposals as a necessary shift toward efficiency and patient-centered care, while critics warn that privatization efforts could limit access for vulnerable populations. His nomination signals a potential shift in healthcare policy under Trump's administration, one that prioritizes innovation, personal choice, and cost reduction over expanding government programs. If confirmed, Kennedy's policies could lead to significant changes in Medicaid, Medicare, and broader healthcare funding structures across the U.S.